Most of the time, a headache is just a headache, right? It's a painful part of life, but it passes. But every so often, that headache isn't the actual problem. It's a distress signal, a warning flare about a life-threatening emergency happening right now.
So let's get right to it. How in the world are you supposed to know the difference? How can you tell a simple nuisance headache from a full-blown neurological emergency? Knowing the answer to that question could literally save a life.
Okay, the first thing you absolutely have to understand is this fundamental split. You've got primary headaches and you've got secondary headaches. A primary headache, like your classic migraine or a tension headache, is when the headache is the disease. But a secondary headache, that's totally different. It's just a symptom, a warning sign that something else, something way more dangerous, like a bleed, a tumor, or a major infection, is the real cause. And you can see right there, missing a secondary headache, that can be fatal.
So today, we're not just going to talk about this. We're going to equip you. We're going to give you a simple but incredibly powerful tool that medical professionals use every single day to spot these dangerous secondary headaches before it's too late.
And here it is. It's called the Snoop method. I want you to think of this as your personal red flag checklist. This acronym, SNOOP, is your guide to knowing when a headache has crossed the line into a potential emergency.
So let's break Snoop down, letter by letter. S is for systemic symptoms. Think body-wide issues like a fever or unexplained weight loss. N is for neurological problems, stuff like weakness, sudden confusion, or a seizure. The first O is for a sudden onset, what doctors call a thunderclap headache. The second O is for older age, specifically a brand new headache that starts after you're 50. And finally, P is for a change in pattern, meaning a headache that is just getting worse and worse. Any one of these is a major red flag.
We're going to start with that first O in Snoop, for onset, because this is probably the single most urgent red flag on the entire list. We're talking about a very specific and very terrifying event. If you or anyone you know ever, and I mean ever, uses this phrase, the worst headache of my life, and says it came on instantly, like a switch was flipped, that's a thunderclap headache. This is not a take some aspirin and see situation. This is a code red 911 emergency, often signaling a brain bleed.
And here's what's so wild about this. Your brain tissue itself, it has no pain receptors. It can't feel pain. The unbelievable agony of this headache comes from blood leaking out of a vessel and irritating the brain's protective lining, the meninges, which is packed with pain sensors. It's not the brain hurting, it's the brain's covering screaming in pain from being exposed to blood.
Let me be crystal clear. There is zero time to waste with a thunderclap headache. The mortality rate for a subarachnoid hemorrhage is shockingly high without immediate medical intervention. That's why recognizing this one symptom is so absolutely critical.
All right, let's move on to the second O in our toolkit, older age. Now, anyone at any age can have a dangerous headache, but when a new, severe headache pops up in someone over 50, it sets off a special kind of alarm bell for doctors. So you might be wondering, what's the magic of 50? Well, it's all about probability. Most common primary headaches, like migraines, tend to start much earlier in life. So when a brand new, really bad headache shows up for the first time after age 50, a doctor's thinking completely shifts. It's considered a dangerous secondary headache until proven otherwise. And one of the biggest worries here is a condition called temporal arteritis. As you can see, this is when arteries in your head get inflamed. That inflammation can squeeze off the blood supply. This causes not just a severe headache, but also some really specific clues, like your jaw hurting when you chew, or worse, sudden vision loss. And that vision loss can become permanent fast if it's not treated. And this table just lays it out so clearly, doesn't it? It shows why context is absolutely everything in medicine. The exact same symptom, a new headache, means something completely different in a 25-year-old versus a 65-year-old. For that older patient, the suspicion for a dangerous cause goes through the roof immediately. All right, let's wrap up our Snoop toolkit with the final 3 red flags. S for systemic symptoms, N for neurological problems, and P for a changing pattern. These are all clues that tell a doctor the headache isn't an isolated event. It's part of a much bigger and more serious picture.
You see, each of these points to a specific underlying cause. A headache plus a fever? That's not a cold. That could be an infection in or around the brain. Sudden weakness on one side of your body or acting really confused? That screams stroke or maybe a tumor messing with brain function. And a headache that just gets worse every single day? That suggests something is growing, building pressure inside the closed box of your skull.
Now, one of the most undeniable signs a doctor can find is something called papilledema. You can think of it as a direct window, a gauge for the pressure inside your head. This is something a doctor can actually see just by looking into the back of your eye. See, your optic nerve is a direct extension of your brain, so if the pressure inside your skull gets too high, from a tumor, a bleed, or a condition called idiopathic intracranial hypertension, it literally squeezes the optic nerve where it enters the eyeball, causing it to swell up. It is a direct, physical sign that something is seriously wrong.
Let's circle back to that S for systemic symptoms for a second. A fever doesn't usually ride along with a normal migraine, but when you get the classic triad of a severe headache, a high fever, and a stiff neck, that is a massive red flag for meningitis, a life-threatening infection of the brain's lining that needs emergency treatment right now.
And finally, we've got P for pattern, a headache that just won't quit. It's there every day, and every day it's just a little bit worse than the day before. That is a classic sign of an expanding mass like a brain tumor. As it grows, it pushes on everything and stretches those pain-sensitive linings, causing that relentless, worsening pain.
So, we've unpacked the entire Snoop toolkit. We've linked these red flags to true medical emergencies like a hemorrhage, arteritis, meningitis, and more. So what's the bottom line here? What do you do with this information? The single most important takeaway from all of this is that these red flags are non-negotiable. These are not wait-and-see symptoms. You don't watch these at home. If even one of these Snoop criteria is met, that headache has officially crossed over from a simple nuisance into a potential emergency, and it demands immediate medical attention.
We've just given you the exact same framework that doctors use to spot a potentially life-threatening headache. This isn't just interesting information. This is a life-saving briefing. Now you have the knowledge. The real question is, for yourself or for someone you love, will you know when to act?